Here we have 60-year-old who presented with acute confusion and hallucination. We've got diffusion weighted sequences, axial gradient echo sequence, axial flare, axial PD and T2, coronal T2 and sagittal T1. When we review the axial DWI, that is the first sequence to review to look for any areas of acute infarct, we recognize there is abnormality along the left cerebral convexity. So when we look at that region on the axial flare, we see abnormal signal and thickening along the subdural space in the left cerebral convexity. There is mild effacement of the underlying sulci and gyri, but there is no mass effect. This abnormality is not much appreciated on gradient echo, PD, T2 or on T1 sequence. Hence it is very important to look axial flare sequence very carefully not to miss such subdural hemorrhages. On retrospective review, this patient had CT scan 3 days earlier and showed a very shallow or subtle subdural hemorrhage which was missed. So in a way, like it is very important to review subdural spaces very carefully on CT scan and axial flare sequence on MRI.